Good evening, good afternoon, good morning to all of you joining from across the globe, the approaching 100 participants who have joined our webinar today. A very warm welcome to all of you, and indeed to those of you in the future who are accessing this recording. My name is Martin Smith, and I'm the Managing Director of Family Planning 2020, FP 2020. But more importantly, I'm your facilitator on today's webinar, and the webinar is Social Marketing, Leveraging the Private Sector to Improve Contraceptive Access, Choice and Use. The Implementing Best Practices and High Impact Practices task team, along with FP 2020, are very pleased to host this webinar, which is the 6th in a series of high impact practices webinars highlighting service delivery practices that are identified and developed by the HIPS, the High Impact Practices Technical Advisory Group, and other partners that demonstrate significant impact in family planning. Now you can see my photo there, that's me on a good day, and I'm personally very excited to be chairing these proceedings. I've been leading and supporting social marketing programs and family planning programs more generally across several countries, including India, Sierra Leone and Namibia, and have a background in working for organizations such as Population Services International and Mario Stopes International. In my current role at FP 2020, I manage our country support work with the 69 countries that make up FP 2020, our data and performance management, and heavily involved in our knowledge and evidence portfolios. And while in many ways this role is a little removed from the field where you might say I cut my teeth in the family planning space, I'm very excited to see on a daily basis the critical importance of ensuring that data, high impact practices and family planning evidence more generally are really driving country decisions to ensure that all women and girls and families generally have access to rights-based family planning. And to that end, I'd like all of you to now invest a bit of your time in learning more about social marketing and how it can be used in family planning to improve access, choice, and use for all people. So I will take you through the structure of this webinar very quickly. So today's webinar will include presentations from True Overholt, who is the Senior Program Advisor at DKT International based in Washington, D.C. From Pierre Moon, the Director at Population Services International of the USAID Support for International Family Planning Organizations, the SIFPO2 program. And from Alicia Bayer, the Chief of Party of PSI's Tanzania Social Marketing Program. Those three presentations will be followed by about 15 minutes of Q&A that we hope will start at about 10 past 10 Eastern Time, so in about 37 minutes from now. Now, please do type your questions into the question box of the control panel that you'll see on the right-hand side of your screen at any point in the presentation. My colleague Rati and I will collate those and make sure we go through them in sequence in the Q&A section. And lastly, in this logistics part, I'd like to direct your attention to the handout section, which is also on the right-hand side of your screen. And here you'll be able to download a copy of the high impact practice itself, along with several other social marketing related resources that True, Pierre and Alicia have suggested as important further reading. So, before we begin, I'd like to take a moment to emphasize the critical importance of the high impact practices in advancing the family planning community's evidence base in helping countries to reach their FP 2020 goals. And we're very thankful to the high impact practices and the implementing best practices task team, and indeed the technical advisory group of the HIPS, for continuing to produce new briefs, as well as creating opportunities such as this one to help diffuse and share this important knowledge. At FP 2020, we deeply value our partnership with the HIPS and we are very much looking forward to strengthen this partnership even further with the addition this month of a HIPS advisor, Laura Rainey, who will join us and provide leadership on how to effectively integrate the high impact practices into FP 2020's work, both globally and across the 69 countries that we work with. Now, a critical component of our FP 2020 country support work is working with country focal points, many of whom I think are on the line now. And those focal points are drawn from government, from USAID, UNFPA, the British Department for International Development, and now for the first time from civil society organizations who have joined this focal point structure. And that group of focal points really have a key role in identifying key strategic points and moments where the high impact practices need to be considered and integrated, perhaps into FP 2020 country commitments, into their strategic plans, into costed implementation plans, which then set out how bold family planning commitments will actually be achieved in practice. Now, we look forward to further strengthening this work, as well as the knowledge exchange activities that will surround these high impact practices when Laura joins us in the next few weeks. So we'll now move on and turn our focus to the high impact practice in question, and I'll spend the next few minutes quickly providing you an overview of that high impact practice on social marketing. Now, the practice supports a distribution of a wide range of contraceptive methods and promotion of healthy family planning behaviors through social marketing. And I'll be covering why this HIP, this high impact practice, is important, the proven impact of social marketing in family planning, and I'll touch upon several models for social marketing, covering some of the key considerations in building or implementing social marketing efforts. I would also like to point out, as we move into this high impact practice, that it was indeed published in 2013, and this HIP, like many other practice areas, is not static, of course, and has significantly evolved since it was first reviewed by the technical advisory group. So please do treat this high impact practice on social marketing as an entry point into this practice. And during our presentation, we're going to be very grateful to True, Pierre, and Alicia for taking us through some of that evolution, building on products towards services, a total market approach, and other ways in which this practice is evolving swiftly. So social marketing makes contraceptive products accessible and affordable through private sector outlets such as pharmacies and shops, while using commercial marketing techniques to achieve specific behavioral goals. And I'm sure most people on the line are familiar with this. So in the next slide, please. So the social marketing was originally designed, and still in many ways fills this gap in the middle of reaching those who are not served with free programs that are often coming through the public sector and are not necessarily served by high-priced commercial products that are targeted to the wealthiest segments and quintile. Social marketing programs can be designed also to reach the poor if product prices are subsidized sufficiently, of course. Conversely, when subsidized social marketing programs are ineffectively targeted, it has been found that they can crowd out commercial brands. Social marketing interventions can help, firstly, promote a wide range of methods. There's strong evidence to show the impact of social marketing programs on the availability of condoms, oral contraceptives, injectables, and cycle beads for the standard date method, with continuing research needed to look at the impacts of social marketing on emergency contraception, implants, and IUDs. Social marketing interventions can also help improve access by tapping into large networks of private providers. This complements the public sector family planning distribution system in many cases by utilizing the extensive network of commercial and non-governmental sector outlets such as pharmacies, shops, community-based distributors, private healthcare providers, outlets, kiosks, and a range of other channels, including the crucial community health worker channel. It can also reduce geographic and socioeconomic disparities in family planning use. An analysis of demographic and health survey data has shown that even among the poorest people in many of the world's poorest countries, significant numbers of women do obtain their contraceptive method from a private sector source. It can also help to reach underserved young people. Research suggests that adolescents generally prefer to obtain their contraceptive method from private sector sources, which tend to provide more anonymity than public sector sources, and that subsidization can be a very effective tool within this private sector channel to reduce cost barriers for young people. And next slide, please. And in terms of the impact of social marketing in the family planning sector, it has been shown to increase contraceptive use. At least 3 systematic reviews have found that social marketing has positive impacts on clients' knowledge of and access to contraceptive methods and condom use specifically. As I said earlier, it can be an effective way of reaching young people in changing attitudes and sexual behavior if social marketing programs do indeed communicate through multiple channels and reach a large proportion of young people, as well as making contraceptives widely available. It can have an impact in terms of helping to sustain family planning gains, and there is evidence of contraceptive use continuing to increase even after social marketing programs come to a conclusion. Now, I'll just go through 3 social marketing models that are outlined in the high impact practice. And again, I make the point about evolution here, and these models are evolving, and we look forward to hearing more about this from our presenters in just a moment. The high impact practice lays out 3 main models for social marketing in the family planning sector. The NGO model, which is likely to focus on achieving health impact and serving the poor, as it does not need a financial return in many cases, and does not need to necessarily be concerned with program sustainability in the short run. But obviously this is changing as the financial landscape around us changes. Social marketing programs managed by NGOs generally can have greater control over the full marketing mix, as brands are often created and managed in-house by a particular organization rather than owned by a commercial manufacturer. A second model that the HIP lays out is the manufacturer's model, which is a partnership between product manufacturers or suppliers that control the product and the brand, and the donor supports demand creation efforts to grow the overall market. In addition, these programs generally support the expansion of commercial distribution systems to expand the reach of commercial brands into more distant areas. And programs using the manufacturer's model often negotiate the introduction of lower priced commercial brands or price reductions for existing brands in exchange for market building support from donors. There is, of course, a hybrid model which blends aspects of the NGO and manufacturer's model in order to better meet both the sustainability and the family planning access objectives. And these hybrid models include, for example, NGO-based programs with high cost recovery or cross-subsidized activities and partnerships between non-profit and for-profit organizations. Some NGOs also implement direct partnerships with contraceptive product manufacturers to market and distribute their products on a sustainable basis. Other examples of the hybrid model include fully commercial products, sustainable programs more generally, or some combination of indeed all 3 models. And as I come to the conclusion of our section on the high impact practice itself, it's worth bearing in mind some of these key considerations which I'll just outline now. Firstly, the matching of the social marketing model to the program objectives and the country context is absolutely crucial for success, to ensure that there's significant coordination among key players for the effective segmentation of the market, as we discussed a little earlier. Thirdly, conducting research to ensure that appropriate social marketing program design and implementation is ensured. Fourthly, to use the power of social marketing to introduce and scale up access to and use of new contraceptive products and brands. To invest in behavior change communication as a key component here. And sixthly, and most importantly, arguably, to plan for sustainability from the outset. Now, this is an entry point and insight into the social marketing high impact practice. and I'm glad to say that we're bang on time at 9:45. And I'm very excited to hand over now to my colleague True Overholt from DKT International to take us through his presentation. So over to you, True.
Excellent. Thank you so much, Martin, for that great introduction to family planning and social marketing in particular. And thanks to all of you who are on the line joining us. So my name is True Overholt. I work at DKT International. I'm in our head office here in Washington, D.C. I've been with DKT for nearly 5 years, 2 of which were actually spent at our office in Ghana, which is where I got a lot of my experience in terms of really seeing the DKT approach to social marketing up close. Next slide, please. So yeah, here we go. So today my presentation is going to really touch on 3 major points, the first of which is about social marketing as a whole and kind of where the industry has come and where it is now. And then the second 2 points are going to be more specific to DKT in particular. The first, and these are things that are really unique to DKT and things that are interesting and that juxtapose a bit with what is in the brief, because these are where DKT has kind of evolved, as Martin has laid out earlier. And so the first DKT-centric point will be about our cost recovery and sustainability. And then the second point will really focus on the value of branding and how we've used branding to help expand access to contraceptives and really increase the size of the market that we serve. Next slide, please. So the first, the scope and growth of social marketing. Modern contraceptive social marketing started in the mid to late 1960s, but we've really seen an explosion in the field in just the past 20 to 25 years. You can see in the table there, even 20 years ago in 1995, we've increased the number of programs that we see around the world, but really we've seen a massive increase in the number of CYPs that are being delivered by social marketing programs. And this is DKT, MSI, and PSI altogether. And there are other programs that exist certainly, but those are 3 of the largest international actors in the social marketing space. And so if we want to look at why the CYPs in particular have gone up, I think the largest attribution is because of the increased sophistication of social marketing programs. Originally, the way that social marketing programs worked was quite simplistic. They maybe only distributed certain types of products. They were only piggybacking on certain types of parts of the distribution chain that existed. And so over time, social marketing has evolved to leverage more of the supply chain and work with different products. Now we see social marketing programs selling and marketing medical devices like IUDs, implants. We see them marketing pharmaceutical devices, pharmaceutical products, as well as different formulations of pharmaceuticals. And then we've even seen the expansion of new products like DMPA sub-Q, which DKT has been rolling out in Nigeria. And we're seeing that the introduction of some of these products in big markets is actually being facilitated by social marketing. And that probably wouldn't have been the case even 20 years ago. The last point that I wanted to touch on is that many of these programs are working in very challenging places. As Martin said, social marketing exists to serve part of the market that is in between the private and public sectors. And in some of the places where social marketing has really expanded, we're seeing that it's because the public sector cannot reach everybody that it needs to reach, or it's overburdened, and it's simply there's no capacity left to serve the rest of the market. And the private sector won't go there either because it's not profitable or those supply chains simply don't exist. And so social marketing is serving that in between. It's actually reaching people that aren't being reached by existing market failures. Next slide, please. So one of the most interesting parts of the DKT story, in my opinion, is our cost recovery. And so you can see the top line number. DKT, as any social marketing program, we sell the products. We don't just give them away. But the big distinction is how much revenue we generate through our sales. And so in this table, you can see the bottom line is the coverage ratio. That's basically the amount of sales revenues we have divided by the total amount of expenses that we have. Typically, it's around 70%, which is impressive. In last year, it was a little bit lower because we've opened new programs. Those programs are spending money, but they're not generating as many sales yet. But in the coming years, we expect to see that number creep back up to 70%. So the big question is, why is this beneficial? Well, there are a lot of points. The first is that we achieve great donor efficiency because our sales revenues cover so much of our normal operating and running expenses. When we do receive donor money, those funds go directly towards the high-hanging fruit, the hard things like service delivery or demand generation or behavior change communications. And so when we do receive that money, it goes directly towards those things that we couldn't do on our own. A second benefit is that we have more stability, and I mean that in a few different ways. The first is that because we receive less donor money, we are less subject to the turmoil that accompanies the political situations around donor money. And this isn't just talking about the US, but there are elections everywhere from a lot of these countries in the UK, the US, the Netherlands, for example. And so because we receive less of those funds in the first place, we're less exposed to the turmoil. Secondly, our programming is not driven by donor decision making. And by that I mean donors often focus on specific parts of the market, like reaching rural areas or delivering services just to youth. Because DKT has more of its own funds with which it can support programming, we are still able to address urban markets or the general population without neglecting them because of need to focus on just particular things that matter to donors. And then thirdly, we're able to continue working in extremely poor countries like DRC, Mozambique, northern India, for example, because we have some of this cost recovery that's inherent in our programming. And then lastly, DKT is actually able to self-fund some of our expansion. An example of this is our program in Ghana started in 2011 with seed funding from DKT itself. And so this is beneficial because DKT itself is able to bear the risk of starting up a program without putting donor funds at risk. And so we can make that investment. We can take our time to develop a strong, sustainable platform in that country. Once we think we have something that's attractive to donors, we can then go and promote that program and receive funding to scale up programming. But instead of using donor funds for the risky part of actually starting a venture, we're able to leverage DKT's own funds. The second and the bigger question is, how do we do it? And so DKT achieves cost recovery through two methods. One is between our different programs, and then we also achieve cost recovery within the country program itself. So I'll start with the first, which is that DKT has several large programs that started in the early to mid 1990s, notably in the Philippines, Brazil, Indonesia, and Mexico. And those programs, as the general income of those countries have increased, DKT has increased the prices that it charges for contraceptives. And similarly, at the same time, as technology and manufacturing has gotten better, the cost of family planning products has actually decreased. And so there's been a divergence in how much money we're actually able to ask for when we're delivering these contraceptives and how much they cost. And so some of our programs are actually generating profits that we are then able to use and plug the budget gap, so to speak, in a country like DR Congo or in Mozambique, where people simply don't have enough money to pay for higher priced products. And then the second point is that we actually are able to increase our cost recovery in country itself. And to this point, I will ask that we go to the next slide. The way that we do it is branding. And so within a given country, DKT will sell, for example, 2 different brands of condom. And what we do is we have a high price brand and then a low price brand. And the profits from the high price brand will actually subsidize the losses or the subsidy that we offer on the low price brand. So as an example, imagine that you have a premier condom like the one you see on the screen that sells for 10 cents. And then imagine that you also have a low-priced condom called Trust that you sell for 2 cents. Now, both of these condoms cost 4 cents from the manufacturer. And so every time I sell a Trust, I'm actually losing 2 cents. But every time I sell a Premier, I'm gaining 6 cents. So through this model, you're actually able to reach an equilibrium point where you can sell a certain number of these subsidized products and have it be cost neutral because you're also offsetting it with profits from your higher price brand. And so this point is particularly important in countries with high inequality. And if you look at a place like Nigeria, people in Lagos are probably, they have more income. They're able to afford that higher price product that somebody in northern Nigeria is not able to afford. And so in our mind, we're actually charging more to the guy in Lagos to help deliver the same product, right? The same condom to somebody in northern Nigeria. But the way that we do it is through branding. And so we develop these attractive brands. We create these really interesting these brands that people want to use, right? When we create the marketing and advertising for something like Premier, we come up with a brand proposition, which is basically, what is this brand all about? And so we're able to create a tone and a feel to the brand that makes people want to buy it. And we're also able to segment the market by targeting our advertising at only certain kinds of people. So for a high price brand like this, we are going to target them through the media mix. If we know that wealthier consumers are more active on social media or certain television stations or certain radio stations, that's where we'll put our advertising. If we know that lower priced consumers are more apt to use or consume billboards or print media or otherwise, that's how we will advertise towards them. And so we're able to develop these brands that really resonate with the target market. A second benefit of branding is that you're better able to use mass media because people immediately know the brand. Imagine, if you will, sometimes you watch a television commercial and you know it's a Coca-Cola brand before, or sorry, a Coca-Cola commercial before you even see the logo. That's because they've done such a good job of creating what that brand stands for in your mind that you can recognize it before you actually see it. And so we've done some of the same thing with our advertising, and the big benefit, or one of the new things that we've done, is umbrella branding. And this is where this has been particularly effective with the female contraceptives, where we will develop a brand called Lydia, for example. But under that umbrella brand, we have different product lines. We have Lydia oral contraceptives, Lydia emergency contraceptives, and Lydia IUDs. And umbrella branding is useful for a few reasons. First is that it establishes consumer trust. The consumer uses a Lydia product, and they don't necessarily draw a distinction between the actual type of product they use, but they trust the brand. Similar to the way that Gillette, men who are shaving will use a Gillette razor, Gillette shaving cream, and Gillette aftershave, right? They trust the brand itself without really drawing a distinction about the product. Secondly is that when we have a consumer who's using a Lydia product, for example, as a woman moves through her reproductive life cycle, she will continue using that Lydia brand because she trusts it, right? She might move from an oral contraceptive to a Lydia IUD depending on the demands that she has in her life. And so we can create a lifelong consumer by developing strong umbrella brands. And then I'm sure some of you are sitting there looking at this and saying, why would somebody pay 10 cents for a 4-cent condom? And this is the part of branding that is curious, is that it defies logic, defies reason. But this is the wonderful part about what we do, is that there are parts of social marketing that don't even attempt to appeal to logic. We would prefer to reach out and touch people's emotions, because more than anything, if there's any act that humans do that is emotional, it is sex. And so with that, I'd like to go to the next slide. And so DKT has long found it ironic that people, right, beer brewers, cigarette makers, car manufacturers have all been able to use sex to sell their products, and yet people who actually work in the family planning industry have not done so. And it's been curious to us to say that we shouldn't use sex to sell our products, and we shouldn't eroticize the products that we're using. But really, that's a lost opportunity, and that's something that DKT has been working on over the past few years, because if you only promote a condom for a condom's sake, then you're going to reach the part of the market that understands the health benefit. But by that same token, you are going to miss the part of the market that doesn't value using a condom because they don't think they're at risk, because they think it interferes with intimacy, because of any number of reasons. But if you start changing the messaging around your product to say you should use a condom because it enhances intimacy, because it's more pleasurable, because it will bring you closer to your partner, you're actually now expanding the market. You're talking to new people. You are reaching out, and your message is resonating with new people that you were missing before. And so by focusing only on a public health communication platform, we're actually missing out on some of the benefit of what we could be doing. Related to that is that when we tell people that a condom is not just a condom can be a caipirinha condom, or an ultra-sensitive condom, or a strawberry condom, you're actually legitimizing the model that we have, right? When a condom is no longer just a condom, that gives you a reason to develop brands. And the branding, again, is what supports, right? It undergirds the entire DKT model of cost recovery. And so this idea of eroticizing family planning goes hand in hand with developing strong brands, and it helps support what DKT does. Lastly, I mean, eroticizing a condom is pretty easy because it's the product that you use at the point of sex, during the act of sex. But it's a little bit more complicated to do this with something like an IUD. But DKT's tried. Within the past 2 or 3 years, we've started running ads in Indonesia, for example, talking about how when you use an IUD, or you have a preventative method, you're able to enjoy the moment of sex, right? You're not as worried about the potential consequences, and that freedom actually enables you to enjoy the moment more. And what we found is that this has been particularly effective in reducing men's biases against IUDs, which was an important point for us, because that has been a significant reason for opposition to IUD use in Indonesia. So again, by using messages about sex and pleasure, we're able to actually expand the market. And with that, thank you very much for listening, and I will hand over to the next presenter, my colleague Pierre Moon.
Thank you, True, and thank you, everyone. As many of you will know, DKT and PSI share much of the same DNA, so it's always interesting to hear what DKT are working on. My presentation doesn't talk about sex or pleasure much at all, but we do talk about it a lot at PSI also. So my name is Pierre Moon, and as this slide shows you, I'm the director at PSI of the USAID program Support for International Family Planning Organizations. If we can move on to my introductory slide, thank you. PSI has also moved many of its products and services to greater cost recovery, and in some markets, such as South Africa or Latin America, we have set up product lines and social franchises that operate at full cost recovery, also without any donor subsidy. And there's actually a link to a short article about that provided in the handouts. We recognize DKT's great work on this, and so for the next 15 minutes, we shall focus on a slightly different story, which is how PSI approaches social marketing today. We'll tell our story with one country-level example from Tanzania, which my colleague Alicia will speak about, and I'm actually just going to speak for 5 minutes or so about the PSI approach from a global perspective. And let me reiterate what Martin said at the start, how grateful we are to FP 2020 and all those who work on high-impact practices for creating this chance to talk about social marketing. So PSI and social marketing, what's the story? Let me just begin by stating that PSI has a presence in over 60 countries. And here, for example, you can see a campaign image from our PSI Somaliland program. We might be marketing oral contraceptives, IUDs, as True says, hormonal implants, water tablets, rapid diagnostic tests for malaria, self-testing for HIV, and much more besides. For the uninitiated, I should also highlight that PSI social marketing also works through public, private, and not-for-profit sectors. Social marketing can be applicable to the public sector and health interventions in general, or as the 2016 Global Health e-learning course on social marketing said, social marketing is about so much more than distributing subsidized products and services. As this slide states on bullet point 2, and as True was saying also, just as economies and health markets evolve, so has social marketing. What is possible in a market such as Kenya or the Philippines is very different today than it was 20 years ago. And we even find that every 3 or 5 years we see big changes in markets that impact on our work and approaches. One of the most significant changes in social marketing was perhaps the shift this past decade to more of a total market approach. And Martin alluded to this earlier when he highlighted the importance of coordination among key players. It's impossible to do justice to such a complex topic as TMA in 3 or 5 minutes, but perhaps a simple way to describe it is that 15 years ago, an organization like PSI might have been trying to sell or distribute as many products as we could to get them out there and used. And for some products, such as condoms or malaria nets, in public health terms, this was, and still can be, the most vital way to respond. But nowadays, PSI also works with many actors, including regulators, importers, ministries of health, policymakers, and commercial actors, so that they are increasing their footprint in a market. And it's through this approach that we can reach the most people and grow the whole market sustainably. And you'll see here on point 3, I think it is, yes, the key question to answer is, where is the market shortcoming? Only once this is identified should we start designing solutions. Next slide, please. Just to build a little more on this TMA perspective and its link to social marketing. Here you're looking at what we at PSI call the market donut. And in the middle of the donut, you'll see the jam, the core functions of the market, supply and demand. And in the middle, very small there, you'll also see a consumer. She's wearing orange today, and at PSI we often call her Sarah. Surrounding this, you see the supporting functions, the rules and players in the market. And I share this today because successful social marketing requires insight analysis and evidence-based decisions, not just about the consumer supply and demand, but also the total market. Our focus on the consumer at PSI is wrapped up in PSI's marketing processes, and we generate insights from sources as diverse as epidemiology, focus groups, audience profiling, the recent trend for human-centered design, and Alicia will touch on this in her slides that follow me. I just want to give a country-specific example of all this theory in action. PACE is PSI's network member in Uganda, and PACE work in 105 of Uganda's 112 districts. In Uganda, there was an obvious gap in IUD availability in the public system. This was one of the major market shortcomings. So subsequently, in 46 districts, PACE was capacity building and strengthening management of public and private facilities to increase access to long-acting and reversible forms of contraception. One effect of this has been, for example, a 30-fold increase in women voluntarily choosing an IUD in the past year in the public sector. Next slide, please. Here I just wanted to take a pit stop to describe another evolution in social marketing, which was PSI's evolution from products to services. PSI provides services through an array of channels, including social franchise clinics, public sector facilities, mobile outreach, community-based distribution, through referral, and even through our own sites. Now, in 2017, you'll see PSI provides comprehensive family planning, contraception, in 32 countries. But you'll see on point 2 that as recently as 2008, the scale-up of PSI's works on LARCs was much smaller back then. Back then, in FP terms, we were often just seen as the condom and oral contraceptive people in many countries. But so much has changed since then. Next slide. And finally, before I hand over to Alicia to share some examples of this work in Tanzania, here's just a quick flavour of the impact of this work at PSI. And you can see 100 million CYPs provided globally in the last 4 to 5 years, and 176 million disability-adjusted life years averted. And I thought it was a lovely introduction by True to look at the combined impact of great organizations like DKT, Mary Stopes, and PSI on this field. And I will now hand over to Alicia, who'll spend the next 10 minutes or so providing a more detailed explanation of social marketing in Tanzania.
Great, thank you, Pierre. Good morning, good afternoon, everyone. My name is Alicia Bayer, and I'm currently the Chief of Party of the Tanzania Social Marketing Program. And I've done social marketing in PSI and MSI, both in Asia and Africa. So next slide. Enough about me. You can go to the next slide. Thanks. Okay. So my presentation today really, I want to present the nuts and bolts of decision making for FP marketing in Tanzania. And we really began a couple of years ago with a market analysis, and that exercise led us to market segmentation, which in turn leads us to product-specific activities. So in this presentation, I'll go over this process and then drill down specifically into the OC market and some of our activities there. My slide deck is very thick with information, but I'll just touch on 1 or 2 points on each slide, and you'll have the deck for reference. I do want to add that I think that while I'm talking specifically about Tanzania, there are remarkable similarities in FP markets, particularly in Africa. Next slide. So just to start with the market segmentation, next slide. Okay, so we start at the biggest picture first, and here we've calculated the total use and need for FP by urban and rural women. And what we see is that the great majority of need is really with the rural women in Tanzania, 2.7 million. But as you'll see later, the needs and wants are quite different for rural and urban women. Next. So here we have the CPR for urban and rural women, and the blue bits together are the total CPR. The lighter blue is traditional CPR, and the dark blue is modern CPR. And we see that rural CPR is much lower overall, but traditional use by urban women is more than 2 times that of rural women. This might be counterintuitive at first, but we can begin to understand the psychographics where the rural women really need to be convinced of family planning as a category in general. Why should I plan my family at all? While urban women generally want family planning, but need a method that's right for them. So we can imagine if we were able to convert even half of these urban women who already want family planning to a modern FP method, we would increase their modern CPR from 34 to 40%. Next slide. And here we have the method mix, again by rural and urban. There's no real surprises here, but we see a trend common in many markets in Africa where short-term methods make up the majority of CPR. So in Tanzania, short-term methods make up 65%, but for adolescent girls, it's even up to 80%. So one issue with short-term method use is high discontinuation. And in marketing terms, we call this loyalty. In Tanzania markets, we have a product loyalty issue when it comes to short-term methods. Next slide. And the last slide I want to show you in terms of our market analysis is this one. And this is really about equity. Here we have CPR by wealth, where we have the poorest quintile on the left and then the wealthiest women up on the right. Wealthy women have higher CPR than poor women. When we have high subsidies throughout the market, it begs the question of sustainability. A more expensive, newer generation product might help to address this discontinuation and target those urban women, transitioning them away from traditional methods. And it would increase the value or sustainability of the total market. Next slide. So our key findings from our market analysis is really high unmet need, particularly in rural areas, a shift to long-acting methods, but still high STM use, and then a higher CPR for wealthy and urban women, including higher use of traditional methods. Next slide. So that brings us to the segmentation. And segmentation is really the bridge between our market analysis and our activity level. So the next slide. So pulling together all the information, including the quantitative and qualitative work, we're able to paint a picture of our target audience. And I won't read this slide, but I just want to give you a sense of how we triangulate all of the information that we have collected in our market analysis to pull our archetype together. This is Najma, the urban women who we're targeting for the FP branded OCs. And as you can see, we've outlined some key findings along the 4 Ps of marketing. The next slide, please. And that's Fatima. And Fatima is our archetype for our other social marketing brand, the OC, the Familia OC. So those are our two women for our segmentation. The next slide. The next slide is our 5 A's of, we'll go through the activity level. So at this level, we really become product or service specific. And PSI Tanzania has a range of both short-term and long-term methods. So to touch very briefly on the LARC side, we have 2 primary service delivery channels, a franchise network as well as outreach teams in the public and private sector. Altogether, these channels provide over 200,000 long-term methods annually. The main focus of these outreach methodologies is really not sustainability, but rather focused on increasing use and access. The next slide. So we've done our market analysis and we've looked at the big picture, and then we look at the segmentation where we take all that big picture information and we begin to draw an archetype. And then the last step really is to flesh out the activity levels. So for us, we use the 4 Ps of marketing for our branded FlexiP product. Here we have our strategy for Najma, our wealthy urban woman. So starting with the product P, we prioritized repositioning the brand, redesigning the packaging, and we added information in the packaging to address discontinuation and side effects. Under the price, we implemented a 32% price increase, and we plan to increase this further. So we want to differentiate by price the FlexiP from our Familia brand. For the place P, we want to focus on places where women really go, and we've seen a real shift in the past 5 years in pill-seeking behavior. Women who access pills have shifted from public to private sector. So 19% in pharmacies and drug shops 5 years ago to 45% today. And this is really an unusual jump that we need to leverage. So what we're looking at is places where the markets have changed or evolved where we can have an impact. And last, the last P is promotion. And I think that there's challenges around traditional promotion because of the regulations for ethical products like OCs. And I also think that, as we know from a lot of our qualitative work, women tend to listen to providers. So the real potential, I believe, for promotion is with changing the behaviors and attitudes of providers through interventions like medical detailing and secondary sales. The next slide, please. So PSI has really evolved our marketing thinking, and our new strategy reflects much more on the 5 A's rather than the 4 P's. I've shown here the 5 A's, and there's more information about the 5 A's, which is available in the USAID Market Shaping Primer. But whether it's the 5 A's or the 4 P's, you can see that we've enhanced the markets for OCs in Tanzania by focusing on those key findings from the market analysis. The next slide. So last, touching on a few of the outcomes and challenges. The next slide. So here we have the 3 outcomes of social marketing as outlined in the HIT paper. So these 3 outcomes are increased contraceptive use, reaching youth, and sustaining family planning goals. I think Martin mentioned these earlier in his presentation. And I've touched on use. For adolescent girls, we are working on some innovations using human-centered design, where we have seen that adolescent girls really know how to identify a girl-friendly provider. So we have implemented a project where the girls are going and doing mystery clients. They went out and reached 1,000 providers as mystery clients and identified 200 of those providers as girl-friendly providers. So then we can focus on those providers and addressing some of their barriers. In Tanzania, they have a lot of barriers around their perception of the policies and laws, and also just their own information around family planning counseling. So this project, while it's still new and very new innovation, has a lot of potential in really reaching the providers that girls want to go to for family planning. And for sustaining family planning markets, I think, you know, there's a lot that we could say here, but PSI has been working in the past 5 years with a local NGO who we supported to evolve into a social enterprise. So now they're able to take over the FlexiP brand as well as popular social marketing condom brand. And we've worked closely with the MOH as well to build their understanding of market stewardship and TMA. But there are challenges and opportunities ahead. So this is the next slide, please. So here we have part of our original market analysis, and this is our market landscaping exercise. This is a very small summary of the exercise, but here at the top of the map, you see this map really reflects the market donut that Pierre showed earlier, with the value chain at the top from manufacturers to consumers, and then the market functions along the left. The red blocks represent the market barriers that we identified, some of which we've worked on addressing in the past few years. But you can see in the red circle that we've identified that importers have a barrier to entry because of the free and highly subsidized products. They often don't have visibility into the potential profitability of the OC market in Tanzania. It's a common claim, and sometimes with validity, that social marketing organizations could be more sensitive to sustainability. For Tanzania, I would argue that there's room in the market for cost recovery for family planning products. If we have products that have price differentiation and product differentiation and strong marketing. So, you know, right now we have many different products in the Tanzania market, but they're all actually the same sort of generation and kind of OC. So when you bring these different products and you segment the market, we really need to have product differentiation as well as price differentiation. We also know that there remains an important space for social marketing at all levels, the highly subsidized and the less subsidized. But the highly subsidized products really do increase the overall use and the rural access. And as you see from the need in Tanzania, that the rural access is really critical. The next slide. So that's the end of my presentation, but I would just sort of summarize with saying that the in-depth market analysis that we did, supported by USAID, has really helped us to understand the role that PSI can play, but the role that we can play in leveraging partners as well to increase family planning in Tanzania.
Thank you very much indeed, Alicia and Pierre and Drew. Fascinating to take us through many practical examples that relate to our social marketing high impact practice. We've had 144 participants on this webinar, many of whom have been asking questions, which we're going to do our very best to get through in the next 6 minutes. But please do rest assured that questions that aren't answered, we will take on in follow-up to the webinar, of course. And the first question is an excellent one, I think, which is this, and I'll go to one of our presenters in a moment to answer this first up. But Andrei Sinlukov asks us, what are some of the tangible indicators that can be used to incentivize everyone to play nicely within the social marketing space, and who can play the most effective broker role in dealing with all market participants, public sector, social sector, donors, etc., to ensure that this playing nicely happens effectively? And Pierre, I'm going to put you on the spot first and ask you for your thoughts and a little bit of your experience, but I'm only giving you 60 seconds to do that.
I'm smiling because it's an absolutely brilliant question, and it's one we face every day in our work. The simple answer is that most of our organizations have evolved so much that it's in our best interests to play nicely together. If ultimately the people we're interested in are the consumers in the market, it doesn't really help us if we all go up head to head against each other and try and cannibalize each other's markets. Many of us have changed our incentive structures in our organizations and our indicators so that they are about total market growth, about sustainability, and about partnership. Now, that's not to say that there's not going to be spaces in the market that there's competition where sometimes we butt heads against each other. But the idea this day that you need an honest broker to get everybody to play nicely together, I can understand that point of view. I kind of feel most implementing partners have moved beyond that and are roughly on the same page together.
Thanks very much indeed, Pierre. And I'd love to give that question to others, but I fear I need to get through some other questions, if that's all right. So I'm going to pose this one firstly to Alicia, and then I'll ask True for his follow-up comments, if that's okay. And this question came from Thibaut Alamea. Thank you very much, Thibaut, and who asks, can you give examples and talk more about social marketing for clinical methods, IUDs and implants? And we heard about this from Alicia and from True, of course. But Thibaut specifically asked about safety concerns, quality concerns with clinical methods, and how this is coordinated with providers. So you mentioned the 5 A's, Alicia, and the assured quality element of your framework. So your thoughts on Thibaut's question first, and then over to True.
Sure. I mean, I think that we can look at it from PSI and DKT and MSI have really been looking at the long-term methods through a social franchising approach where it's focused on clinical quality in the franchise. But from a marketing perspective, I think it's important to understand our target audience for franchising. So often, in many markets, young urban women are more concerned with confidentiality, whereas older women, married women, are more concerned with quality. So there's sort of the outward consumer marketing appearance of our franchise and getting women in the door of the franchise. And then, of course, there's the inward nuts and bolts of increasing the quality of the franchise.
Excellent point, Alicia. Just to follow up on that, excellent question. I would add that a lot of the social marketing organizations are now actually engaging in provider training themselves to ensure that the people, right, the providers who are inserting these methods, who are delivering these services, have the clinical competency, that they have the confidence and the skills required to make sure that they are able to deliver these services both safely and with quality.
Thanks very much, and we have a follow-up question on this theme with 120 seconds still to run. We're doing our best here, which is, what are some of the effective approaches to market segmentation that effectively target the intended population without having this market cannibalization effect? And I'll go back to you first, True, and then ask Alicia or Pierre to comment.
Sure. I mean, I think the most effective is just price, right? If you have something that's very expensive, somebody who's at the bottom end of the market is not going to buy that. The second one would be method mix, or the media mix. To me, we do a lot of segmentation based on how we reach certain consumers, how we advertise, right? Whether it is through activation tie-ins at nightclubs or advertising only on certain channels, doing live in-person promotions. Those are effective ways of delivering those products or marketing those products to the right market. Secondly is how you actually deliver it. In a country like Nigeria, we will only sell our high-priced condom in certain areas where we know there are consumers. In urban slums, for example, you would only see the low-priced condom because we know that market doesn't exist there.
And I realize I'm out of time, but I'm going to push my luck, which has been a theme of my life, actually, and see if we can go for a couple more minutes. But I have a couple of wrapping up comments. But before I do that, I just wanted to get to Timur Seidov's question. Thanks, Timur, who asks, are there any practical strategies or tools to accommodate both the social marketing approach within a total market approach framework within a single program? So, Alicia or Pierre, what are your thoughts on a country in which social marketing within total market are sitting nicely together?
Pierre here, I'll have a go at that, and then Alicia, if you wish to follow up. There's actually a great course on that on the Global Health e-learning website, which has tried to marry social marketing with total market approaches. So I'd highly recommend that. And perhaps I'll just end by saying that it's a great question because it isn't easy. These are huge questions, and we're trying to marry the micro with the macro. But I think we're showing examples of where we're having success in that space. So I think it's the journey we have to go on. But it's an excellent question. It's not an easy path.
Great, and I'll ask True, Alicia, any concluding comments with regard to this question or overall?
Yeah, I mean, I'll just maybe add that there's, the first question and the last question are very similar. How do we all work together? And I think when we have price differentiation, I think when we have clear objectives, so a social enterprise or a high-end product is their bottom line is revenue. And they're going to want to work in the more urban areas and get high revenue, and they're less concerned with volumes, but they're still adding to the value of the market. And then that's complemented with social marketing brands that should be focused to youth and vulnerable and rural areas, and we need to make sure that we're complementing, and it takes time. I think that's a thing that we've worked on a lot in the Tanzania Social Marketing Project, where it was not clear at first, but working on where the public sector, the highly subsidized social marketing, and the revenue-focused social marketing or cost recovery brands need to stand.
Thanks, Alicia. True.
Last comment I would make is that a lot of social marketing just happens by where's the opportunity, and so it's a lot of creativity. We act as though markets can be easily segmented. That's not always the case. Markets are messy. A lot of social marketing takes place by evolution, as we've seen throughout this presentation. So it's a growth process, and we're glad that everybody's been able to attend and see how social marketing has evolved so far.
Thanks very much indeed. And just the last, or the penultimate slide, please. So the recording of this 63-minute webinar is going to be available at the 2 links that you see on your screen. Please spread the word far and wide. And the last slide. So for more information on the current social marketing high-impact practice, one of 17 family planning high-impact practices at the website you can see at the top there. For more information on the Implementing Best Practice Initiative, the website in the middle, and FP 2020, the third website you can see. And I would just end by thanking everyone for participating. And social marketing and family planning, we talk about metrics and impact, and I think we may have set a record in terms of the number of participants on this webinar at 144, but the impact is of course up to you and up to all of us to make sure that social marketing as a high impact practice for family planning is taken far and wide and integrated into the wide range of countries that are looking to accelerate access to, use of, and equity within the family planning space over the crucial few years we have left to 2020 and the important path that we track towards the Sustainable Development Goals in 2030. So with that, this is the team signing off and thanking you very much for your participation, and we look forward to talking to you on our next HIPS webinar very soon indeed. Have a good day.